think there's some value in actually doing some cutting edge research and cutting edge work in rural Australia and looking at those paradigms, because I think those paradigms would be far more scalable and sustainable than, let's say, what's just being developed here.
Yeah, so we use heavily in the Aboriginal medical services, especially in the top end, throughout Queensland and also in New South Wales in Redfern. And what they use us for is to understand the situations their patients are in day to day. So as you can imagine, being any form of health professional, you are faced with challenging questions, possible diagnoses and possible treatments. How does any medical specialist stay up to date with all the worldwide information out there?
We've developed our own satellite services out there, so it's rather uncontended now, and it gives us the speed necessary to be able to communicate the way in which we need to, a little faster and more efficiently. Other things that Kimberley Aboriginal Medical Service has done recently is we've used our own resources to put an uncontended fibre link between our head office, which is based in Broome, and that's gets us all the way down to Perth in a uncontended fashion. Then what we've done in some of our other services, if they're not on satellite, we've gone to 4GX, which has increased the speed in which the connectivity gets to Broome, our main server in Broome, and of course being an uncontested pipe all the way down to Perth, we've increased our internet speeds now by 20-30 fold, which has been great in regards to increasing the use of telehealth services and also operating an electronic health record. My name's Lucy Falcocchio. I'm the Health Systems Development Manager for the Kimberley Aboriginal Medical Service. Our organisation is an overarching body that provides administrative support and governance to our member services. We also run 5 primary healthcare clinics, 4 satellite dialysis services and a renal dialysis mobile unit. We operate across approximately 425,000 square kilometres of Australia's harshest terrain out of the Kimberley. Beautiful part of Australia, but also comes with its challenges. We're an Indigenous organisation and we have approximately a 50-50 membership of Indigenous and non-Indigenous workers. Our workforce is approximately 220-230 people, and with our member services incorporated into that, we would have around 580 to 590 people working across the Kimberley quite tirelessly, looking at closing the gap in regards to Indigenous health in Australia.
How hard is it to look after that footprint that you just mentioned with Indigenous, non-Indigenous clients?
Being where we are in Australia, it comes with its challenges. You look at being above the 26th parallel, so of course there's infrastructure problems. We don't have connectivity is always going to be an issue in the far north. In regards to access, getting in and out of a lot of our remote communities is dependent upon seasons of the year. Also in regards to transport in and out, it's either via 4-wheel drive or via light aircraft. We're pretty fortunate to have dedicated staff that are quite happy to reside out there. Doctors staying out there, doing their swings in and out there. So look, the area comes with its challenges. You have language being also different language groups across the Kimberley, and of course then it's establishing rapport, and we're dealing in healthcare, so when you have the language barriers and understanding of medical terminologies, then there's the added barrier of building trust and rapport prior to being able to establish the the necessary relationships that you need to be able to deliver quality healthcare services. So we have our barriers and our challenges to delivering, but by the same token, we're pretty innovative in the way we do things up north, and we do what's necessary to get the job done.
Can you explain some of the issues you have with connectivity and how you resolve them?
Certainly. In regards to connectivity, while the rest of Australia is enjoying the broadband that's being rolled out across Australia, unfortunately, because we have such congestion in our exchanges, the national broadband network's really not going to make that much of a difference in remote areas because of the inability to connect. Then you also have, schools coming out and everyone's on their little mobile devices, so you're all competing for the same amount of contention, hence it slows your systems down when you're trying to operate electronic health records, telehealth services in the area. Then of course when we start looking at areas like the central desert of Australia, there just is no mobile available out there, so we've been pretty good and we've developed our own satellite services out there, so it's rather uncontended now and it gives us the speed necessary to be able to communicate the way in which we need to, a little faster and more efficiently. Other things that Kimberley Aboriginal Medical Service has done recently is we've used our own resources to put an uncontended fibre link between our head office, which is based in Broome, and that's gets us all the way down to Perth in a uncontended fashion. Then what we've done in some of our other services, if they're not on satellite, we've gone to 4GX, which has increased the speed in which the connectivity gets to Broome, our main server in Broome, and of course being an uncontested pipe all the way down to Perth, we've increased our internet speeds now by 20-30 fold, which has been great in regards to increasing the use of telehealth services and also operating an electronic health record.
Yeah, so we're used heavily in the Aboriginal medical services, especially in the top end, throughout Queensland and also in New South Wales in Redfern. And what they use us for is to understand the situations their patients are in day to day. So as you can imagine, being any form of health professional, you are faced with challenging questions, possible diagnoses and possible treatments. How does any medical specialist stay up to date with all the worldwide information out there?
The great point about being in a conference on informatics is actually looking at what the future of humanity would be. I am a big believer in the fact that informatics in general is going to be a basic human right. Information is the new currency. I think people require information. People need to be given that information, and the informatics community, unknowingly or knowingly, is actually shaping the world in terms of how the world will consume information and make a better life for themselves. So being here, I think that's one of the big things that I always like to revel in an informatics community. Whether it is our social media, whether it is how we look at health, whether how we look at education, in all of these spheres, informatics is becoming central to human existence, and it can actually compensate for a lack of basic human rights. For example, if you don't have the right, you don't have the connectivity, you don't have roads, even then, informatics can help you. You don't have access to doctors or healthcare, informatics can help you. I think that's one of the more empowering messages that I generally carry back from an informatics conference.
Where do you see the future of e-health and how it can help Aboriginal and Torres Strait Islander communities?
I personally believe that e-health is the future in ensuring a better delivery of healthcare. What it's going to allow is for that establishment of rapport. At the moment, if we look at any of our patients, we have some of the highest rates of chronic disease, hence when they get to an acute stage we have to fly our patients over 2,000 kilometres down to Perth to get services. Some of our patients never make it to Perth. They don't know who they're meeting, so to be able to, for instance, have a telehealth session with a specialist down in Perth, whilst you've got your Aboriginal health worker there, and you've also got the doctor that you've been working with and establish that rapport with, that trust with, that initial step of telehealth, I feel, and making that connection is so vital in regards to ensuring our patients arrive safely, feel safe there. So I think that that's important. Also access to those specialty services, to have to fly a day, sometimes 2 days to get there, to see a specialist in busy cities, and language is a barrier. I think that just having the access there and on the spot, you're not having the delays in times. We don't see so much acuteness. You can start doing some preventative type health in regards to treating something prior to it becoming acute. So I think it is very much the future of the delivery of Indigenous health in remote Australia.